And there are two questions associated with oligometastasis. One wants to know about how is this specific type of metastatic disease treated when it's presented as a recurrence. Another individual has asked, can it be surgically removed or ablated for that primary tumor to be treated in the hope that then that will slow everything down?
So I can comment a little bit about that. Oligometastatic disease is a word that refers to when there is metastatic disease outside of the breast and local lymph gland area in the armpits, but that it's just a little bit. So for example, if a woman is diagnosed with breast cancer and she has a lump in her breast and a lump in the lymph gland in the armpit and just one spot in the bones in her back, but not anywhere else. And it's an area where there's a lot of research going on, but we don't actually have a lot of information nor firm guidelines, really. Oftentimes, the best thing to do in that situation, and really any situation with breast cancer, is to have a multidisciplinary care team consult on the case and have, meet with a surgeon, a medical oncologist, and a radiation oncologist, and kind of come up with a plan. You can take a kind of either of two approaches. One would be to say, this is metastatic breast cancer, even though it's just a little bit, and to treat it as such and really focus on the systemic therapies. Or the other approach is to say, well, it's really only just a little bit. Let's be more aggressive and let's do the systemic therapy, but let's also do some local targeted therapies like surgery and or radiation to the specific spots with the goal of kind of covering all of the spots. Unfortunately, we don't have any really high quality data yet on whether or not that approach changes the long-term course of disease. But, as a doctor who's been doing this for quite a while now, I've definitely seen a lot of women who've done very well with that type of an approach. So I think it's something that really needs to be personalized. And sometimes what we do is we start with systemic therapy and then over time we incorporate the local therapies. There's not one right answer. And so it's a little bit of the art of medicine when it comes to managing oligometastatic disease.